My vision for rural health practitioners is that they are better understood and better looked after and better supported than they have been in all the decades I've been alive. It's really true that doctors ignore their own health for lots of reasons, and the Rural Doctors Foundation has some nice research backing that up, which triggered this whole program. Throughout all of my time, including as a GP, the care of doctors' health and doctors' self-care has been central to my clinical work and my teaching work. And this job just came along as something that was really trying to improve for rural doctors particularly, but other rural health professionals, their access to good care, because it needs to be confidential and it needs to be independent. I'm signing up, one, to be a GP, which I love being. I get to go out to 3 towns that I really like. So Stanthorpe, Gundawindi and St George, and I've been out there a lot for work over the last 30 years. A typical day, I'm going to walk in, I'm going to have a list of patients to see for the day, and in terms of confidentiality, the practice isn't going to know who they are. I've got a room that I'm using within someone else's practice, which is extraordinarily generous from the practice and from the foundation to organise that. And then I'm going to have, for first visits, an hour with each person, which is a real chance to get to know who they are, but also the work they're doing in this community, how long they've been here, and what they see as all of their health risks, their human normal health risks, as well as a practitioner in the town they're in. And then the follow-up visits will be half-hourly visits. But importantly, you can't just be there every few months. So I'll also telehealth with people for follow-up, check on results or check on progress or see the effect of a medication change. I'll be working there, but the records I hold will be off-site at another practice completely, and I won't be even connecting into the practice's electronic systems. So I'll be completely independent of that. Again, thanks to the generosity of a practice and the foundation support. So I think us being able to tell these people on our reconnaissance trip that everything was going to be completely confidential is very heartening to some people. It's only as we sort of started to do the program that I realised from my doctor-centric point of view how hard it is for doctors to access independent and confidential care in a small town. And then of course going out and speaking with people, I realised how difficult it is for the nurses or the allied health personnel in the town to get exactly the same access. They also have the problems and the barriers and the conflicts going to see a doctor that they work with in, day out. And I think particularly the nursing staff in general practices who work constantly with those doctors, they really can't get that access to independent care. So really only being part of the program showed me that this wasn't important, it was really important. It's in the interests of the rural communities. Ultimately, having health professionals who are staying and looking after them and being well enough to do so is the way to look after rural communities.